Hey, welcome to another edition of Shlomo's Corner. This is Shlomo. Today I'd like to talk about something that's been on my mind. Lately there have been a lot of, fiscal conservatives and Tea Partiers talking about, ending a lot of social programs that we have. I'm not going to talk so much about that. I just want to, real quick point. Right now, as it currently stands, if you're a child, there are programs to take care of you if you need them. If you are a senior, there are programs to take care of you. But everybody in between is on their own, which means, if you think about the numbers, it's kind of scary. And this is part of the whole single payer argument or nationalized health care, which I 100% favor, is that from the time you turn 18 until you retire at 65, that's a total of 47 years, which, if the average life expectancy in the United States for a male is 73 years, then the problem we have is you have 47 years of your life where nobody gives a fuck about you and you have to fend for yourself the entire time. That's the majority of your life. Most of your life, you work, and sure, people should strive to take care of themselves. But there is so much that is unforeseen in life. So much that can happen to someone that can crush them, and you have no control over, whether it is an auto accident, whether it is cancer. Nothing waits until you're eligible for Medicare. No disease is going to wait for your eligibility for Medicare or SSI or disability. No one says, okay, well, it's here. This is why we as a people, for the majority of our lives, whether we're 3 years old, 23, 33, or 63, or 73, should be taking care of each other. It's a crazy thing to think that the majority of your life you spend working to protect yourself when we could all be protecting each other, just as we do for the children and the elderly. And I think this is part of the problem with nationalized health care. And let me say, otherwise, it's really more of the problem that we have with a jealousy that exists between younger people today and senior citizens. That they see their grandparents receiving all kinds of benefits. Of course, the grandparents have paid into the system. This is the whole thing. You've paid into it. It's an insurance policy. They see them receiving all kinds of things. They don't foresee themselves having that. Of course, because the rhetoric exists that it's unsustainable. But there's this little bit of a jealousy there. Why does Grandma and Grandpa get all of this? We're not going to have this. They're jealous already, but we give it to them now. Give it to everybody now. When you consider what you have to pay in premiums, that's much more expensive than having nationalized health care. And that's just kind of my point. Just the idea of having to spend, by law, 47 years of your life in this great unknown which is called life, and we don't work to help each other. We just send everybody out on their own. And that's my little rant for today. Peace.